Okay, let's unpack this. Today, we're diving into some, well, pretty compelling material. It really invites us to examine one of America's most influential medical organizations, the American Medical Association, or AMA.
Right.
We've got a unique collection of footage, reports, and detailed accounts. And they challenge how we might understand institutional authority in medicine, especially concerning what's become widely known as gender-affirming care.
What's fascinating here is how the AMA, an organization often seen, as the gold standard, navigates these rapidly evolving and highly sensitive medical areas.
Yeah.
Our mission today is really to extract the key insights from these particular sources, carefully examine the claims and the counterclaims, and help you understand the different perspectives presented.
Right, sort of cut through the noise.
Yeah, exactly, allowing you to form your own conclusions.
By the end of this deep dive, you'll have a clearer picture of the debates, the specific criticisms leveled by these sources, and the broader implications of these discussions within the medical community.
And it's important to remember, isn't it?
Yeah, definitely. The sources we're looking at today, they contain strong viewpoints. They sometimes use pretty provocative language.
For sure.
Our aim is just to distill their content impartially, to help you understand the arguments and perspectives presented within them. We're not endorsing or adopting their specific phrasing.
Absolutely. Just presenting what's there.
So before we delve into the specifics, let's establish just how significant the American Medical Association actually is. What exactly is its standing in the medical world, according to these materials we have?
Well, the sources describe the AMA as undeniably foundational in American medicine, often referred to as the gold standard for medical associations.
The gold standard, okay.
Yeah, and it's a massive organization. We're talking presiding over 250,000 dues-paying members.
Wow.
That includes everyone from physicians and medical students to, specialized surgeons.
Mm-hmm.
And beyond its membership, it publishes this comprehensive code of medical ethics, spearheads major public health campaigns, and, well, it effectively operates as a quasi-governmental organization in many respects.
Quasi-governmental? That's interesting.
Yeah, and perhaps most crucially, the AMA issues the majority of the continuing education credits doctors need, to maintain their medical licenses.
Ah, okay. So that's real leverage.
Exactly. It makes their influence incredibly pervasive.
That's a huge footprint then.
Yeah.
So with such an immense platform and influence, how do their policies and statements then shape both medical practice and public perception, especially around a topic as sensitive as gender identity?
Well, it really raises an important question, doesn't it, about the weight their pronouncements carry.
It does.
When an institution with that kind of authority makes a declaration, it sets a powerful precedent. There's no doubt about that.
Okay, so our sources, they trace a specific trajectory for the AMA's involvement in what they refer to using terms like gender confusion or gender identity disorder treatments. Let's look at how their stance developed over time, particularly from the perspective of these critiques.
Right. According to the sources, the AMA's formal involvement in this area seems to date back to 2008. That's when they adopted Resolution 122.
Resolution 122, okay.
And this resolution explicitly supported drugs and surgeries used to, quote, treat gender confusion. It proclaimed that these treatments, and the sources are quite stark in their description here.
How so?
They describe them as including hormone therapy, procedures involving breast removal in young people, and genital reconstruction surgeries.
Mm-hmm.
And the resolution said these were not experimental.
Not experimental. So they were presented as established practice.
Yes. The AMA then classified them as safe and effective treatment for gender identity disorder. And at that time, the AMA framed this particular stance as a matter of non-discrimination.
Okay. Here's where our sources indicate the focus intensified, particularly around interventions for children. What did the material highlight about this escalation?
Indeed. The sources point to a really significant development by 2021. The AMA's then Vice President and CEO, James Madera, he sent a letter to state governors. And in this letter, he urged governors not to ban what the sources controversially describe as castration sterilization of gender-confused kids.
That's strong language from the sources.
It is. Madera's letter claimed that, quote, empirical evidence demonstrates that trans and non-binary gender identities are normal variations of human identity and expression.
Normal variations, okay.
Furthermore, he asserted that science backed the use of hormonal sterilization surgery to prevent gender-confused patients from killing themselves.
Right, the suicide argument. The idea that these interventions prevent suicide is, well, it's a powerful and very often cited argument.
It is. It carries a lot of weight.
But what does our material say about the factual basis for that specific statistic?
This is a crucial point that our sources directly challenge. They highlight a moment during Supreme Court oral arguments in U.S. versus Scratty.
Okay.
It involved the transgender ACLU lawyer and activist Chase Strangio.
Right. I remember reading about this.
According to these accounts, Strangio beckled under pressure from Justice Alito and reportedly admitted that suicides were, quote, thankfully and admittedly rare among trans youth.
Rare. So not the high rates often mentioned.
Exactly. The sources present this as a direct contradiction to the common and often alarming claim of high suicide rates used to justify these interventions. The insight here, I think, is profound. When a key argument for medical intervention relies so heavily on a statistic, rigorous scrutiny of that statistic's foundation is absolutely essential.
Especially when even its proponents, under direct questioning, acknowledge a different reality.
Precisely.
So the argument often used to support these interventions is being directly questioned by the sources. What about the AMA's response to this kind of pushback or scrutiny more generally? How did they react?
Our sources detail that by 2022, the then president of the AMA, Dr. Jack Resnick, openly criticized all scrutiny of gender-affirming care as disinformation.
All scrutiny? Wow.
Yes, he publicly stated, and I'm quoting from the sources here, "I'm angry about how science and medicine have been politicized, about the flood of disinformation that seeks to discredit data and evidence undermine public health."
So framing criticism as political attacks.
Pretty much. Resnick also claimed that drivers of disinformation were spreading falsehoods, asserting things like gender-affirming care clinics are performing genital mutilation surgeries on teens, or not involving families in care decisions, or using medical treatments on young children.
Okay, those are serious counterclaims.
They are. However, the sources explicitly assert their own counterclaim, stating flatly that these procedures have in fact been performed on gender-confused kids.
So direct factual dispute there.
A very direct one. And if we connect this to the bigger picture, it suggests a strong and very public defense of their policies by the AMA, even in the face of growing external criticism and specific allegations from various sectors.
It certainly highlights the often intense polarization of the debate, doesn't it?
Absolutely.
Now, let's dive into the core of some of this material. What the sources refer to as damning exclusive footage of a private meeting in Michigan. This isn't just policy, it's a direct interaction. That gives a different kind of insight.
Right. This specific meeting, according to the sources, involves several key figures. Dr. Bobby McCla, who was the incoming AMA president at the time.
Incoming president, okay.
Michigan Representative Brad Pette, who's a former teacher, a Republican. And Dr. Eton Hay. Now, Dr. Hay is known as the Texas Children's Hospital whistleblower. He's also an AMA member with practical surgical experience in placing puberty blockers.
So someone with hands-on experience in this area.
Exactly. The sources claim this footage completely discredits the AMA, asserting it proves their support for what the sources call trans healthcare is based on, quote, fake science and willful blindness. Strong claims again.
Very strong. Okay, so one of the first major points of contention reportedly revolved around puberty blockers. What did Dr. McCla claim about them, and how is he challenged by Dr. Hay?
Well, Dr. McCla reportedly stated quite unequivocally that puberty blockers are reversible, just flat out reversible.
Right.
However, Dr. Hay, leveraging his background, as an AMA member with surgical experience in pediatric endocrine disorders, directly confronted this claim.
How?
He presented facts about what he described as the real risks, particularly when puberty blockers are used at Tanner stage 2.
Tanner stage 2, remind us what that is.
That's the early stage of puberty. It's where a child first starts developing secondary sexual characteristics like breast buds or testicular growth. Typically happens around ages 11, 12.
Got it. So early puberty.
Right. And Dr. Hay highlighted that the risks, when used then, include things like infertility and micropenis. These are serious potential outcomes, he pointed out.
And what was Dr. McCla's reaction to such a direct evidence-based challenge, especially from an AMA member with practical experience?
According to the sources, Dr. McCla's reaction, well, it demonstrated no alarm.
No alarm.
None reported. He reportedly dodged Dr. Hay's questions, and quite strikingly, the sources say he mocked Dr. Hay's concerns with a dismissive blah, blah, blah hand gesture.
A hand gesture, seriously.
That's what the sources claim. And crucially, Dr. McCla then asserted that he was not an expert at all in the science related to these specific medical procedures. He deferred instead to unnamed experts.
Not an expert, the incoming president.
That's the reported claim. This exchange really highlights a critical tension, doesn't it? When a leader of a major medical association disclaims expertise on the specific science underlying their organization's policies.
Yeah, it raises significant questions about accountability and, well, the basis of that gold standard designation you mentioned earlier.
Exactly. Where does the buck stop, essentially?
The discussion then reportedly turned to patient regret rates, another critical area in these debates. What did the AMA president suggest about regret, and how is that challenged based on the material?
Dr. McCla, according to the sources, simply parroted long debunked claims that the patient regret rate for all of these interventions is supposedly only 2%.
The 2% figure. That comes up a lot.
It does. And the sources then delve into a critical examination of what they identify as the most oft-cited study claiming this low 2% regret rate. It's a study titled All Regret After Gender-Affirming Surgery.
After surgery, okay.
And the critique emphasizes that the study's title itself, by focusing exclusively on surgery, means it does not measure regret for the tens of thousands of American teenagers who took any measures up to the point of surgery.
Ah, so it excludes people who only used blockers or hormones.
Precisely. Interventions like puberty blockers or cross-sex hormones, which, as the sources point out, still forever alters their body, their voices, their future fertility, even without surgery.
So the study often cited for the 2% regret rate might not even be measuring the full scope of interventions or their long-term effects. That's significant.
That's a major point in the critique.
What other methodological issues did the sources highlight in this study?
Well, the critique details several pretty significant methodological flaws. It asserts that the study's author left out several relevant papers, inappropriately included another, and even miscalculated the basic data.
Miscalculated the data.
That's the claim.
Yeah.
Furthermore, many of the individual studies included within this larger review lacked adequate follow-up. They only tracked patients for maybe a year or two.
But regret might take longer to surface.
Much longer. The sources note that regret often takes an average of 8 years to manifest, so short follow-up misses a lot.
8 years, okay.
And another alarming detail highlighted is that one study included had a 36% loss to follow-up rate.
Over a third of the participants just disappeared.
Effectively, yes, meaning the outcomes for a significant portion of those patients were simply unknown. You can't really draw firm conclusions with that much missing data.
That's a lot to unpack about a single statistic. The depth of this critique on the regret rate study really highlights a crucial insight for all of us listening, I think.
About that.
When an institution relies on data to justify significant medical interventions, the methodology behind that data is just as important, maybe more important, than the headline figure.
Absolutely. You have to look under the hood.
It's a powerful reminder to always scrutinize the studies behind policy, particularly when dealing with long-term, irreversible decisions. This certainly raises an important question about the robustness of the data supporting such a low regret figure.
Especially, as you say, when considering the long-term, irreversible changes involved in various forms of this care.
Right. Now, beyond specific statistics and the efficacy of treatments, the sources reveal what's described as an internal inconsistency within the AMA's own statements. Regarding the very nature of gender identity itself, what exactly was this contradiction presented during that Michigan meeting?
This is truly a fascinating point, actually. Dr. Hay apparently presented Dr. McCla with several of the AMA's own statements, highlighting what seems to be a profound internal conflict.
Okay, like what?
Well, one AMA brief, for instance, stated that the assumption gender identity can and should be changed is not based on medical and scientific evidence.
So identity is fixed, according to that brief.
Seems to imply that yes. Yet another AMA statement said, quote, neither gender nor sex are stable objective categories.
Wait, say not stable. That sounds like the opposite.
It does, doesn't it? And the third AMA document defined gender as someone's inner sense of being a woman, a man, another gender, or genders, or no gender, which is quite subjective.
Wow. So fixed, not stable, and an inner sense. All from the AMA.
According to Dr. Hay's presentation of the sources, yes. He argued these were obviously incompatible statements, asking directly, does gender identity change or it doesn't?
That's a fair question.
This internal inconsistency within the AMA's own documents offers a critical insight, I think, into the challenges institutions face when attempting to define rapidly evolving and deeply personal concepts like gender identity.
Especially when those definitions underpin medical policy.
Exactly. It forces us to ask, How can a gold standard organization provide clear guidance when its foundational definitions appear to contradict each other?
And how did Dr. McCla respond to this pointed question about the AMA's own conflicting definitions? Did he clarify?
Well, Dr. McCla reportedly sided with the idea that what people think they are can change.
So he leaned towards the not stable definition.
It seems so. And then he linked this again to a suicide rate. He claimed it was 50% or higher.
50%? That sounds incredibly high.
The sources directly call this particular statistic made up. They state flatly that there's not even a random activist study that claims that there is an actual 50% suicide rate.
So, a potentially unsubstantiated statistic used again.
That's what the sources allege.
Yeah.
So you have this strange situation. In one breath, the AMA's own brief says identity shouldn't be changed, and in another, its incoming president suggests it can change, and then immediately links it to an apparently unfounded high suicide rate.
That is confusing, to say the least. And what about the repeated assertion from Dr. McCla that he wasn't an expert in these specific medical areas? How did that factor into this part of the discussion?
Right. The sources say he reverted back repeatedly to his assertion that he's not actually an expert, specifically in, say, endocrinology or plastic surgery.
But Dr. Hay challenged that.
Reportedly, yes. Dr. Hay pointed out the obvious problem with this line of argument. As president of the AMA, Dr. McCla is supposed to be an expert in the AMA's code of ethics and, at the bare minimum, the Hippocratic Oath.
Right. He's the leader of the organization setting the standards.
Precisely. The question posed by Dr. Hay was, effectively, if the AMA is not the expert on this, then who precisely is?
That's the expert paradox you mentioned.
Yes. It highlights this fundamental challenge of institutional leadership. How can an organization lead effectively on complex medical issues if its top leadership disavows direct expertise in those areas?
And what about other critical reports and findings mentioned in the sources? Was Dr. McCla confronted with those during this meeting?
Yes, he was. Dr. McCla admitted he had not read the Trump administration's Health and Human Services, or HHS, report, nor had he read Michael Schellenberger's W-PATH files.
Not read them? Why are those considered significant by the sources?
Well, our sources assert these reports were significant because the HHS report apparently delved into the lack of robust evidence for gender-affirming care in minors.
Okay.
And the W-PATH files, which came from the World Professional Association for Transgender Health itself, allegedly revealed internal communications. These showed medical experts themselves expressing doubts and concerns about current practices.
So internal doubts within the main organization promoting these standards.
That's the implication from the sources, yes.
Yeah.
They claim these reports exposed the medical experts' own admissions of doubt and implicated W-PATH and other organizations in concealing evidence that doesn't support their recommendations.
And McCla's reaction to being told he hadn't read these potentially critical reports?
He reportedly became defensive and deflected. He questioned if Dr. Hay was suggesting that doctors at the University of Michigan were hiding data.
So deflecting rather than engaging with the substance of the reports he hadn't read.
That's how the sources portray it. It indicates, perhaps, a resistance to engaging with external critical reviews of the evidence base that supports AMA policy.
Okay. After these, well, clearly challenging exchanges, Dr. McCla reportedly connected Representative Pette with one of the AMA's esteemed trans medicine experts. Who was this individual and what perspective did they offer?
Right. So the AMA's chosen expert for Representative Pette was Dr. Jessie Corin, described in the sources as a family medicine doctor who is trans herself. The sources described the conversation with Dr. Corin as even more disturbing than the previous interactions. They suggest it paints a picture of how individual cases are viewed through the lens of gender identity, even very young ones.
Even more disturbing. What was a key anecdote or perspective shared by Dr. Corin that stands out in the sources, particularly in relation to young patients?
Dr. Corin described a specific patient, a 7-year-old in Marquette, who identified as transgender.
7 years old?
Yes. The anecdote highlighted that the child's main concern was how to diminish any appearance of a bulge in her ballet leotard.
A 7-year-old's concern?
Yes. Dr. Corin noted that from a purely medical standpoint, the medical treatment was just how do we avoid rashes in this kid, from tucking.
Right.
But crucially, Dr. Corin also relayed the mother's account. The mother said that before social transition, which meant letting her grow her hair out and choose her own name, the child had frequently talked about wanting to die. And that, according to the mother via Dr. Corin, that had stopped as soon as they let her start making those choices.
So, linking social transition directly to cessation of suicidal ideation at age 7.
That's the connection presented. This perspective offers a glimpse into how social functioning and how children feel are prioritized within what's presented as the AMA's expert opinion, even at very young ages, and the perceived link to mental health outcomes.
And the sources found this disturbing. Why?
The sources suggest this anecdote is disturbing, likely due to the emphasis on social affirmation and identity concerns at such an early age, potentially, in their view, circumventing deeper psychological exploration or other potential underlying issues.
Got it. Okay, this material isn't presented in a vacuum, as you said. The sources describe a broader landscape of challenges to what they controversially term the trans industry and gender-affirming care. What else is happening out there, according to these reports, that forms this wider critique?
Right. The sources definitely paint a picture of a broader pushback. They highlight several external developments that, from their perspective, challenge the prevailing consensus on gender-affirming care.
Such as?
They mention the Daily Wire's prior investigations into Vanderbilt Hospital. According to these reports, that led to a Supreme Court victory.
A victory that did what?
It allowed Tennessee and, quote, other red states to ban what the sources powerfully denounce as barbaric procedures for the medicalization of gender in children. Again, very strong language used by the sources.
Okay. What about internationally?
They point to the British government, which is said to have totally walked back their policies in the wake of the Cass Review.
The Cass Review, right. That was significant.
Hugely significant.
Right.
Our sources detail how this influential independent review concluded that the evidence base for gender-affirming medical interventions for children and young people was, quote, remarkably weak.
Weak evidence.
Yes, and it recommended a much more cautious, holistic approach, focusing more on mental health support.
So, significant shifts both legally in the U.S. in some states and from a major governmental review internationally. What else contributed to this broader critique in the sources?
Well, the sources also point back to those various government reports we discussed earlier, specifically reiterating the Trump administration's HHS report and Michael Schellenberger's WPATH files.
Ones Dr. McCla hadn't read.
Exactly. Which they claim exposed the medical experts' own admissions of doubt and allegedly implicated organizations like WPATH in concealing evidence that doesn't support their recommendation.
Any other developments?
Furthermore, they note that the FTC, the Federal Trade Commission, has apparently begun examining what they term gender-affirming care as a potential consumer fraud.
Consumer fraud, that's a different angle.
It is. Yet, despite these reported defeats or mounting criticisms, the sources claim that what they label the trans activist army and gender ideologues continue to double down.
How so?
By seeking legitimization in law, through teachers' unions, and crucially within the medical establishment itself. Allegedly leaving, in the sources' view, children across the country vulnerable to medical procedures they characterize as abuse.
And the AMA's role in this, according to the sources?
The AMA, in this context, is identified as one gigantic pillar that they continue to stand on as the authority of the largest medical association in America.
So the AMA is seen as providing crucial legitimacy.
That's the argument presented. This suggests a multifaceted and intensifying challenge to the prevailing consensus on gender-affirming care, bringing into question the scientific and ethical foundations of these practices as presented by the AMA, at least from these critical perspectives.
So what does this all mean for you listening? We've delved deep into the AMA's policies, the specific claims about regret rates and reversibility, the internal inconsistencies highlighted by these sources, and the broader external pressures from various sectors. The material we've reviewed certainly paints a picture of significant and, well, escalating controversy surrounding one of the most powerful medical institutions in the country regarding gender-affirming care.
And the critical insights from today's deep dive, I think they really highlight the importance of scrutinizing even the most authoritative institutions.
Absolutely.
When you look at the evidence presented from these various angles, from the specific alleged risks of medical interventions to the methodological issues found in the supporting data, it really encourages critical thinking about how expert consensus is formed and maintained.
Especially in rapidly evolving and sensitive areas of medicine.
Exactly.
This journey through the material has definitely provided some, well, moments for me and raised some profound questions about institutional authority and the nature of evidence itself. It reminds us that being well-informed isn't just about absorbing information, is it? It's about understanding its context, its contradictions, and its broader implications.
Well said. And perhaps this raises an important question for you, the listener, to consider. In an age of just constant information overload, Where do you draw the line?
The line between, well,
Between professional guidance, which we all rely on, and what these sources suggest might be, well, ideological influence shaping medical practice and policy. It's a tough question.
it really is something to think about. Thank you for joining us on this deep dive. Until next time, keep exploring, keep questioning, and stay curious.